Good. Welcome, everyone. Thanks again for tuning in to GameSetPadel, the podcast that's all about paddle, whether you're a paddle addict like us or just a recreational player. This is definitely the podcast for you, so thanks for tuning in. Today we have a very special guest with us, Dr. Nicolas. Thank you for joining us.
Thanks for having me.
And as always, we've got Ali as well from the GameSetPadel team. How you going, Oz?
Yeah, good, man.
All
Good. Winning the Americanas every Wednesday, so I'm feeling good.
That's good. Good to have you back. You've been away for a while.
And now there's a FIB tournament to win if you want.
So like I said, we have a very special guest, Dr. Nicolas. Dr. Nicolas is an osteopath. He's known actually on Instagram as the Padel Osteo. So tells you a lot about him, but I'll let you, Doctor, maybe you can introduce yourself, tell us a bit about yourself, how long you've been in Dubai, and when did you get into paddle?
Sure. So I'm 34 years old. My name is Nicolas. I moved to Dubai 6 years ago, just before COVID, perfect timing.
Right.
So I moved here in February 2020, so 45 days before the lockdown.
Lucky.
Yeah. I'm a married man, and I had my two boys here in Dubai, actually. So one
Amazing.
is 3 and one is, thank you,
Yeah.
and the other one is 3 months also. I'm into diapers more than paddle these days.
It's a tough time, yeah.
Yeah. So I actually started playing my first paddle game in 2022. You know, it's actually the same period Dubai organized the 30 by 30 challenge, and they create villages, to promote sports on a daily basis for free. And they had a paddle court on the Kite Beach village, and I tried with friends just out of curiosity.
But that's how it starts, right?
Yeah.
You just play out of curiosity and then...
Then you do a second game, then you buy a racket, and then you know the rest.
then the injuries come, right?
Yeah, could be. But I'm the kind of player that focuses only on one sport. So at the time I was doing badminton, and I gradually switched to paddle, because
Paddle swept me off my feet in a way. I used to play soccer a lot. That was my thing. Twice a week, soccer, as addicted. I still am. I love watching soccer, but now if I have a choice between paddle and soccer, it's always paddle, which is football, right?
I was the same with basketball.
Yeah.
I used to watch all the NBA games, and I had to play basketball at least 2 to 3 days a week. Now I watch more paddle than I watch NBA games, and I play a lot more than when I play basketball. Yeah. Tell us, I'm sure and it's going to sound weird, a lot of people have heard of physiotherapists and have heard of podiatrists. Not a lot of people, I guess, really know I think this is a fairly new thing. What does an osteo do exactly, specifically?
It's not that it's new. Maybe it's less popular in the Middle East than it is in Europe. Okay. And it's more about the cultural aspect. In North America, for example, chiropractors are very popular because this has been the country, the USA, where it developed a lot since the 20th century. In Europe, it's way more osteopaths that develop regarding manual therapy and treating musculoskeletal disorders. So it's basically a manual medicine, which means hands-on treatment. Okay. So the doctor uses their hands to diagnose and treat the patient.
Right. I mean, the closest thing to it might be a chiropractor, but what are the nuances?
So the differences would be maybe the techniques that we use that could be slightly different than a chiropractor's. We know that chiropractors, they use a lot of spinal manipulative technique. Right. We use this kind of technique, but sometimes we love to use also softer technique like joint mobilization, muscle energy technique to relax the tissues. And I also like to add some kind of hands-off technique with the exercise-based program, something that a physio might be doing. So from my perspective, an osteopath might be a combination of a physio and an osteopath.
But you do the whole body, right? So chiro does mostly...
That's true.
The back and spine and neck and things like that, but you do knees, you do elbows.
Yes, exactly. Yeah, from the holistic perspective, because we can have a look at different body parts depending on the reason for consultation, and we can also dissociate the duration of treatment. Like you said, as chiropractors, they tend to mainly focus on the spine. The session duration, sometimes it's shorter for follow-up. It's quite frequent that a session lasts only 15 minutes.
Yeah, of course.
This never happens with an osteopath.
The osteo, because you guys sort of go towards root causes of generally just speaking, and then you hope to fix that root cause, which will then fix the issue.
Yeah.
That's generally.
And the idea is to work in collaboration with the patient. So each follow-up is there to assess the progress, the stagnation, the expectation, and what they're aiming to resume. Because yes, we treat someone with pain, but we treat someone who's not able to do this anymore, or would like to resume this because he's in pain. So we work with all these psychological and social factors also.
Well, tell us, Padel. So, because on Instagram you call yourself the Padel Doctor, I think.
Yes,
Padel
Padel Osteo.
Sorry, Padel Osteo. Sorry, apologies.
No worries.
So, I'm guessing you're seeing a lot of injuries
Yes.
due to Padel, right?
Yeah.
Unique injuries, different injuries to what you generally see.
Yeah, I mean, we all became addicted to the sports, and the training volume could be 5 to 7 days a week. I'm sure you even know people who play 2 games a day. So,
Yeah.
have you ever seen that?
They just did yesterday.
Have you ever seen that with any other sports? That's impossible.
Yeah.
So yeah, like I said, I come from badminton, playing 2 or 3 times a week. I was so sore the next day. There's no way I played 2 days consecutive.
Yeah.
So paddle is a little bit more gentle on the joint, so you feel that you can train the next day. But sometimes when you come from level 0, going to that training load too fast is a risk factor to develop an injury.
Well, that's a bit of the trap, right? Because you think that paddle isn't loading your body, but the more intense, the better you get, the tougher games are.
Yeah.
It actually is a lot of load on
Exactly.
the body.
Yeah. So yeah, like I said, it's quite accessible at first. So you don't need to have a very good level at first. With 10 or 15 coachings, let's say in a month or 2, you're able to master the fundamentals of paddle, and that's when the loads on your joints, on your muscles, and the tendons tends to
I think if you
increase.
get a bit more confident, you think, oh, I can do this more often, I can play, and then...
And then you want to train your smash, so then you overload your
Exactly.
shoulder with the coach. So yeah.
the more aggressive it gets, and the more competitive, etc.
Yeah.
You start taking more risk, stretching. I mean, when I first saw you and met you, doctor, it's because I tore my hamstring playing paddle because I overstretched to pick up a ball, and but I kind of was recovering at the time I saw it, but I had other issues that like my back was starting to hurt and my hamstring as well, my legs. But yeah, so you are seeing a lot more injuries due to paddle, right?
I can't give you a specific number, but these days it represents maybe 20 to 30% of my patient base, the paddle-related injuries. So that's the kind of patient that I love to see.
What's the unique injury you've been seeing that you generally don't see?
Unique, it's hard to say. I like to categorize the injuries with like beginner-related injury, intermediate, and advanced injury. So beginner usually low back pain, 40, 50-year-old male, first or second game, doesn't realize the amount of squats or the rotation that it requires during the game, and they end up in the cabinet next day with a sore back. Then you can have the tennis elbow also, because people, they don't choose the proper racket. Most of the time they don't have the overgrip, so which means that they tend to over squeeze the racket whenever they play back.
So what's the overgrip for people that don't know? You mean it's not thick enough to handle?
Exactly, especially you, for example, you're a tall man, you have a big hand. If you don't play with an overgrip, I guarantee you in the next 3 months you will get a tennis elbow.
I actually have double.
He's got double grip.
You even need
I got recommended by a coach, so correct.
Good.
Yes.
Yeah. So, and then for the more advanced player, it's more the lower limb injury, like the Achilles tendinopathies, because the better you play, the more you jump and the more you accelerate and decelerate to get the most difficult balls. So
of course.
On average, on a 90-minute games, you jump maybe 90 to 100 times just for the smash, but it doesn't count, again, all the acceleration, deceleration that you do, which requires a lot of reactivity from your Achilles.
Yeah, I mean, we're playing again yesterday, and one of our friends who was playing rolled his ankle yesterday, or he jumped, actually, he ran forward, jumped, and then when he landed, he slipped and he rolled his ankle.
Yeah.
And he couldn't play, and he's got a swollen ankle now.
Some kind of lateral ankle sprain can be quite disabling, and people, they tend to minimize this kind of injury, but tell your friend to consult, because there's a higher risk of recurrence regarding lateral ankle sprain, and then you can develop instability. There's like a cascade of events with
We're telling him, get up and get back on the court. we need to
just
play.
put some ice, tape it.
Spit on it.
But what you're saying is so true, because whenever one of the 4 players injures is having pain on the court, you don't want to let everybody else down, because
there is a bit of mental pressure, that, peer pressure, to be honest. No, we're lucky to find another person to kind of jump in, but they weren't that good, so it changed the dynamic. But we do feel for him, and we hope he gets better. But yeah, no, it does happen because paddle is very dynamic movements. Every game is so different. It's not like, again, football where, okay, I'll have the ball, okay, I'll do a sprint, I'll pass the ball, then I'll wait in a position to get the ball back. Here, you're actively involved. I mean, again, the more advanced you get, the more squatting, the more running forward, hitting different types of shots, rotating your body a lot more, etc. So all leads to more use, I guess, and more risk of injury. Which I guess, so do you have any suggestions? We'll talk about recovery of injury, but preventative, right? So what do you think are important things for people to do to avoid getting injured to begin with and to help them with better mobility?
So for someone who comes from complete beginner level, like I said, getting a few coaching might be interesting to master the technique, the proper grip, the different stroke, you know, ground stroke, forehand, backhand, the volleys, bandeja, and vibras. That's the key thing first, to get an idea of the proper grip, because sometimes people, they just overload because of a wrong grip that they hold during the game. Second thing, just before the match, warm up on the courts. You know, make sure that you take 5 to 10 minutes to work all of the shots that we mentioned. Don't show up late for your match and start playing, because again, higher risk of injury, because you need to get to that space, to that pace, sorry. And I like to say that the best warm-up is applying the load on your body that you're going to face at the lower intensity. So just like someone who would go to the gym for a squat session, they start with a body weight squat or with the barbell and no added weight on. Same for paddle. You know that you're going to do all these movements. Use the warm-up on court to prepare your body for that.
Okay. Any particular types of warm-ups? So you just mean just hit the ball?
Yeah, for 5. Look at the pros before they play a match. They don't warm up 2 minutes. They warm up 10 to 15 minutes.
10 to 15, and they're just hitting the ball. You know,
if you have
cables as well.
If you have a coexisting injuries, whether it's on the shoulders, knee, whatever, Achilles, then you warm up, of course, just before you go on the court. So again, you prepare the sensitive tissue just to make sure there's no flare-up during the match.
What about stretching? Because some people, when we were younger, we were always recommended to stretch before any sporting event. But some of the research these days are saying don't stretch too much, because then your muscles get tired more quickly. What's your opinion on that?
The thing is, you want to prepare your muscles to contract. So if you only do static stretching before the game, you don't prepare the muscle again to the load that is going to
So what's static? You mean just stretching your hamstring?
Exactly.
Okay.
Are you going to apply this kind of load on your hamstring during the game? Probably not. So it's better to do maybe something more dynamic when you, I don't know, bend forward with the knee bend, then you extend your hip, or but you see, you do something more dynamic that will be more realistic to what you do during the game. That would make sense.
A lot of paddle places have like what's called like cycles, or like maybe a treadmill even sometimes. So do you think it's better to actually just warm up in terms of do a bit of a jog, not a jog, like, you know, sideways stepping forward, back on the court and hitting the ball, like you said?
Yeah, that would make sense.
Just warm up, basically. Like, get the muscles ready.
You're right. We need to warm up the knees and the hip, because we're going to squat a lot during the match, especially during the defending phase. So doing this kind of thing. Jump rope for the Achilles might be good. Calf raise also, this kind of stuff is really good. But lunges, squat is a very good way to prepare your lower body.
A super important tip is a warm up more than a stretch. Give yourself 5 to 10 minutes at least. I usually come in late, these guys know, and I warm up by getting DP and spraying my legs with DP. I feel warm, and then I start playing. I don't know if it helps,
during the warm-up on court, focus on the control, your sensation on every shot. Try not to. I have a friend, maybe you have one also like this, who hits every ball super hard. So
we have someone like that. No worries.
So it's better to focus on the control, the proprioception, where you feel your body in space, and that would be very, very important.
I think it's also important to you start realizing what works on the court. Like, you don't really, when you need to put power, when you don't need to put power. Like you said, actually, training with the coach, getting the right technique helps, because otherwise you might injure yourself trying to, hitting a very big swing, which you don't need to do in paddle, and you end up hurting yourself or causing, like I said, tennis elbow or just overstretching, right?
It's it's Maury Andrini, one of my mentors, the Argentinian guy who coaches the coach all over the world with his platform, Hello Padel Academy. He always say, faster doesn't mean better in a paddle, or stronger doesn't mean better in paddle. So that's the key thing: when to accelerate, when to slow down the pace, to wait for the proper opportunity. Actually.
What about you personally? How many days a week do you play paddle?
4 to 5 times. Yeah, I leave the
With a 3-month-old baby, that's impressive.
Yeah. These days, I manage to play during weekdays, and I'm off on the weekend. So no tournament for me. I spend time with the family.
Nice.
So yeah.
Those tournaments can drag on. They tell you it's an hour, 2-hour tournament. You start at 8 p.m., you finish at 3 a.m.
We were about to talk about the recovery. So
Yes. So okay, that's interesting. So you play quite often, usually during the afternoons or
yes,
at night?
yeah,
Okay.
afternoon, maybe sometimes around lunchtime, and then I go back to the clinic to do my patients. Yeah.
That'd be nice. Get the endorphins going, get the blood pumping.
Yeah.
Shower down, get back to work.
Exactly. Like this, I have my time, for professional. Then I do my hobby, back to work, and then I spend time with the family in the evening.
That's I think a very good idea.
I have the chance to be able to
Of
do
course,
that.
of course. Not
The
everyone
job is like
does.
10 minutes away from the paddle
Yeah,
club.
but a lot of people say, I mean, they live in New York, or for example, live in Sydney, or even in Dubai. During their lunch break, they'll go to the gym, right? If you've got an hour lunch break or an hour and a half, go to the gym.
Sometimes I skip lunch just for that.
Look, I mean, actually, funny enough, in Australia, it'd be impossible to go play and go back, right? I mean, this is the beauty of Dubai. You're 10 minutes away. Things are closed.
And there's no traffic at this part of the
it's a
day.
good time.
Correct. And all the paddle courts have parking, right? The thing is with Sydney, or like say maybe New York, taking your car there is impossible. There's no parking, even if there is. But Dubai has all the paddle courts have parking.
Facilities here, they have the showers and all that kind of stuff.
Yeah,
Usually very clean, good facilities. Do you usually play with the same crew, or do you just play with random people? Or
Usually, people, they play at the same time during the day. So yeah, you end up finding the same players. But Padel Art has quite a large community. They develop their own app. So to book open match is very good. So people can join. You just decide on the level. Sometimes you can accept or decline the people who want to join.
So it's like Playtomic, similar to Playtomic.
Exactly. They have their own playing topic.
yeah.
nice.
So you usually play at Padel Art. Yeah, they have the app. You get rated by a coach.
Yeah, exactly.
It's good.
You left-sided player, right-sided player?
I love to play left side because I'm a hard hitter. Yeah, I say
smasher.
Nice.
Yeah,
I like
I just said faster doesn't mean better, but yeah.
No, man, we have to get a game in. What can we book a court tonight?
I always choose like the hardest racket. Right now I'm playing with the Leo Augsburger's racket. The Argentinian guy. So
he's an up and comer, man.
it's a Sioux. It's a Sioux. It's very hard, and when you hit your volleys on your smash, it makes like a bullet sound. So it's like a criminal sound.
Yeah.
Is it the Electra or which?
No,
one?
it's called Phoenix Pro. Phoenix Pro 5 Black. Yeah.
Well, he's the up and coming star. He's really young.
He was like top maybe 25 a year ago, and now he's top 15. So the last tournament in Barcelona, they only take the top 16 players.
Yeah.
So he's going to be one of them probably.
Well, they just won. They somehow they made it. Like everyone was shocked. They beat Tapia. I can't remember which tournament
they beat
it was.
all the top 3 pairs.
Yeah, right. Galan and Chingo.
That was legendary.
Tapia, in the final, they outclassed Tapia and Coelho. I couldn't believe it that they won.
Yeah.
It was
I was so happy.
There's rumors that Osberg is going to join. Is it LeBron? I think.
If he joins LeBron, then he better get ready to take some hardcore criticism or.
There was this rumor. Who knows if it's gonna happen, because LeBron changed so many times partner, and everybody knows that he has a temper, and I'm sure you've seen the recent incidents. So think twice before you join LeBron.
See, the thing is, but you can tell it's just he wants to win so badly. That's where the temper comes from. He's so passionate, and like when he was with Galan, they were at the top. So it's very once you're at the top and you come down, it's very hard to accept.
Well, he used to be the number one, right? So he was at the top. He's come down, but also he's a lot older. Like Tapia and Coelho are like 22, 23. Like they're so young.
He's right.
I was watching Navarro the other day in one of the rounds in the latest tournament. Man, he's 36 now. I looked online. He's bloody 36 years old, and his was a star just 5 to 7 years ago.
There's many millennials coming right now, so
it's and hard. The game, obviously, as every sport in the world, gets faster and faster.
Of course,
faster, right? So, would have been. He was also at the top at one point, like number one, I think.
Navarro, yeah. I mean, from his, I'm sure they all had their turn. Like even Galan in a recent interview, he said that he's not number one at the moment because Coelho and Tapia are at the top, but he feels like he's a much better player now than when he was world number one, and it's true.
Yeah.
But everyone's up their level. Like
the equipment is also amazing now, so that's why it's becoming more and more spectacular, the matches that we watch online.
Well, say it's like golf, right? Golf, they used to use different wooden, iron, wooden clubs and stuff, or not type wooden, but now they use titanium. They've actually had to change the rules to sort of be like, okay, that is a bit too powerful. So, and even with the swimming, I remember there was that controversy with the swim in the Sydney Olympics.
True,
The Australian swimmers used to swim with the whole thing, and they felt like it made them go faster. So, I guess as technology evolves,
people find little hacks.
Little hacks, 100%.
Yeah.
So now people like you are considered to be advantaged, now with the equipment, like the taller you are, the more power you can generate, and as it's becoming more spectacular,
But look, I think, obviously power makes a difference, but technique is probably more important than power, because sometimes some of the smashes you see, it's just the right technique, and then like the ball will hit the glass and then bounce out.
Yeah.
And sometimes the powerful ones are too powerful, because you hit it so hard, and then the guy's at the net and he's like right there and he can just like, hit it over. Who's on the world stage, who's your favorite player or your favorite?
Augsburger, that's why I bought his racket.
I say it's not Taka and Coelho.
When I see this guy ending the point whenever he can, I want to do the same thing,
Right. Why do you like, where's Augsburger from? Is he
Argentina.
Argentina?
Yeah.
Okay, right. And you mentioned you have a coach from Argentina? Or
No. It was my former mentor, because I did the Padel certification to also coach a bit of friend. Because now in many residents in Dubai, many communities, you can find paddle courts. And where I used to live, Serena, we had 2 paddle courts. So I started coaching people there, beginners, and
very nice.
Using that method from Elo Padel
Is it something
Academy.
you'd consider full time or?
No. Just as a hobby, another hobby. I like to spread again the paddle
because
thing.
the coaches are doing like very well in the UAE, and a lot of the coaches I talk to, like back in say Portugal or Argentina or Spain, they might make 1,000 to 3,000 euro a month, whereas in Dubai I don't want to say what people are making, but it's way more.
Yeah, for sure.
And there's a lot more opportunity. So like coaches make a better living than a lot of the expat employees that actually work in the UAE. That's
no, but the paddle scene in Dubai is excellent. And when I go back in France, I found that the level is a little bit, on average, lower. When we play here, we have very good players, honestly.
It's the same with Australia as well. We notice that, or when Australians come to Dubai to play with us, it's like, okay, they know how to play, but they're more ex-tennis, like they come from tennis backgrounds, so it's very different, and the quality of the game. Bali's pretty good. We were in Bali recently. We also did a retreat in Bali. They have amazing facilities, beautiful, very nice, clean facilities with recovery rooms, which is what I want to touch on next, is the recovery side of it, right? One thing that they had in almost every paddle place in Bali was an ice bath, sauna, steam room, things like that, which actually, funny enough, Dubai don't really have that in paddle places. But we were doing
700 paddle has I think now, and Central Paddle also maybe. Not all of that, because it's expensive.
It's chargeable, right? In Bali, it was all included in the
but
thing.
Bali, it's like essential. Like you cannot have a paddle court.
Oh, okay.
And it's included in
the mandatory.
And it's included in the court booking. And we were doing it every day, recovery after the game, and we were playing every day, maybe twice.
Yeah.
And also, I could not do that in Dubai. But there, I feel like with the recovery, it made us be able to play a morning training and then a night game. So I don't know, what are your thoughts on recovery and how important is it after a game? Like, what should we do, and how important is it?
So there's 2 major pillars that everybody knows: the sleep for the recovery to allow muscle repair, the growth hormone, glycogen production. So of course, 6 to 9 hours of sleep is usually the best, depending on your age. If you're younger, you need more sleep. Your gender, if you're a female, usually you also need more sleep than men. Apart from that, nutrition, of course, so proper amount of protein, fat, and carbs, because you're using carb during the game, and electrolyte also. If you sweat a lot during the game, it's usually good to drink a specific electrolytes. Apart from that, the cold plunge is quite interesting, but we need to put some nuance in it. I don't recommend to do it right after the game, or you can do it after maybe a tournament, when you know that you're going to feel very, very sore the next day, if you want to play again right after that, because again, we're addicted to it. But I wouldn't do the cold plunge on a daily basis because what we know is that it tends to affect also the muscle hypertrophy. So for example, someone who would go to the gym every day, if you do a cold plunge right after your workout, it tends to decrease muscle hypertrophy by 60%. So yes, you're still going to gain lean mass, but not as much as if you wouldn't do the cold plunge. Yeah.
Right.
So key thing, maybe after a large tournament, to feel okay the next day. We know that it tends to reduce the DOMS, delayed onset muscle soreness. Even better than active recovery. Like it's better to do cold plunge than a cycling, at a low intensity for 20 minutes.
Okay.
But yeah, make sure that you don't do this every day. You might don't have so many benefits. So 2 to 3 times per week. Better during the weekend if you do tournaments.
What about like sauna?
I don't have any data regarding sauna, but I know that it's interesting if you have like a muscle tear because the blood flow, that the vasodilation tends to help to improve the catabolic aspect when you have like a muscle injury. So yeah, if you really have a known injury in the muscles or in your tendons, probably sauna is interesting.
What about more like, I don't know the words, like mechanical or like, like again stretching or warming up or outside, like again there's not a lot of cold plunges in Dubai, so if someone finishes a game and they're sore or like usually I'm very sore the next day and then by the night time I'm okay. And other than sleep and eating, is there, again, stretches, warm downs, for example?
I would suggest, again, the light aerobic work. So if you see that you have a stationary bike at your club, go for it for 15 minutes. Very light intensity, light resistance, just to prevent the soreness the next day. Apart from that, there's no magic. Like again, good sleep, good nutrition, and make sure that if you increase your training load, be gradual and do some plateau. Because there are tissues in the body that have a lower metabolism. So if you go from 1 to 5 times a week, you have more chance to develop tendon injuries, for example. It's not like muscles. When you go to the gym for muscles, you break the fibers, you wait for 48 hours, recovery occurs, and then you can load again very hard your muscles. Tendon is more subtle, so low metabolism, low load every day, and sometimes have some plateau. Don't keep increasing the intensity or the
I think in paddle, again, you tear your tendons rather than muscles, right? So
yeah. We talked about the Achilles.
Yeah.
For all the smash, the rouleau technique, it's more about the rotator cuff in the shoulder, and the tennis elbow is also actually a tendon injury, but it's more like micro repetitive load with the impacts.
Yeah, my hamstring injury was a tendon tear.
Okay.
Or rupture is what they called it. So.
Oh, you had rupture, yeah.
I had a rupture in the tendon, very high up.
Yeah, close to the buttock. Yeah.
Yeah, where it connects to the
hamstring,
muscle.
but tends to heal itself, right? Generally.
Yeah, it took 6 weeks. I was on the court in 2 weeks.
The issue with the tendon is that you sit on it and it tends to make it worse. So the moment you sit, you aggravate your pain.
Yeah, because it stretches. It was very, very painful.
I can imagine.
But now I'm glad I'm back now. But what I do is I wear compressions. Again, I don't know if it's just a mental thing or not, but I warm it up. So I do warm up. I don't just spray, but I do spray a lot of deep heat because I want to keep it as warm as possible is my theory. I don't know if this is correct or not. And then I put the compression as well because I feel like it makes it loose. The heat makes the muscles loose, and then the compression obviously keeps it all.
You mean the compression boots to do like the Venus?
I put a compression sleeve as I'm playing.
Yeah, that's very good.
Right.
It helps for many tendon issues. Also, the adductors, people who have like a groin pain, especially the footballers. We know that wearing those compressive shorts tend to do like a skin slag that offload the tendon. So it's probably also the same thing for the hamstring tendon.
Yeah. I mean, all of us have torn. So Ali has knee problems, so he wears knee braces or not braces, knee compressions.
Yeah, knee compressions.
I always like to watch my opponents where they have like sleeves or straps or brace. It gives information about the weakness.
When we were younger, I used to laugh. The old men used to come into basketball or come to football. This one's wearing a knee brace, elbow brace, this and that.
That's how it is,
And now we're the same, man.
Now it's us. So we've got Yui, who's another one of our friends, and Steph. Steph did a knee surgery, so he wears his full leg compressions. Yui had tennis elbow for a while, so he wears his arm compression. So we're all like, and then we have
robotic.
Another friend of ours, Omar. He's got like
knee,
legs, knee,
elbows,
everything.
So it's like RoboCop, you know what I mean? It's like everyone's got something wrong with him. It's
RoboCop. So what about seeing an osteo in relation to paddle? Is it beneficial to come see you on a regular basis to help again with recovery, avoiding injury, and just feeling better in
So
general?
for the preventive aspect, I can't say because you come to see me once or twice a year, you're going to avoid to develop any injury because we saw that it's highly contextual and multifactorial. However, assessing some mobility range of motion, we know that it can be a risk factor for other injury. Let's say that you cannot flex your ankle fully, you have a higher chance of developing Achilles issue or a knee pain, such as a patellofemoral pain syndrome, which is the #1 cause of knee pain. Same for your shoulder. If you have like poor chest mobility, poor thoracic spine mobility, your overhead range will be reduced, and then you have a higher chance, of overloading the tissues in your shoulder. So this could be assessed quite easily during an osteopathic session in less than 30 seconds. So we know the impairments, the deficits. Also, I like to use what we call the handheld dynamometer to test muscle strengths left versus right, and also different muscle groups to test the ratio. Like this, if I see, okay, you're a right-handed person, but you may be 10% less strong on the, I don't know, elbow, forearm or elbow extensors compared to the left side, there's an issue. There's probably a high risk of injury in the next 3 months. So that could be the preventive aspect of consulting an osteopath to highlight all these impairments.
So I mean, rather than is it beneficial to see you regular, like once a week, for example, once a month, twice a month? Like, would you recommend
If you
that?
don't have any pain, coming to see me twice a year is more than enough. But again, we can use this session to evaluate all these measurements. See you again in 3 months, and you let me know how it feels once that you've been working on those things.
So even as a regular paddle player, like if we play, say, 3-4 times a week, with the soreness and these things,
you might have some symptoms, and then you come to see me.
Okay.
You will always have something.
I'm already booking in my mind. I'm telling you next week. That's it.
I'm thinking if range of motion can help, maybe it'll increase my game by 5%. Let's go and do that.
Don't underestimate what we call the kinetic chain in paddle or any racket sports. Let me give you the example of the smash or the serve in tennis. Whenever you smash or serve, 50% of your power comes from your leg, 30% comes from your chest, and only 20% comes from your shoulder. So if there's one thing to keep in mind as a preventive measure is don't skip leg day whenever you play paddle, because 50% of the power will come from your leg.
Of course,
Interesting. So, and I was going to say, so with the range of motion, like what have you noticed in paddle players? Do you notice their postures? So playing paddle, does it make your posture worse, better from a clinical perspective?
I wouldn't say worse because,
potentially?
like you said, there's so many strokes that we do in paddle that our body is exposed to a variety of position, and that's what we want with the human body. We don't want to stick to one position, so it's not like someone who's doing cycling or rowing. It's repetitive movement in the same position, and your spine is not designed for that.
Yeah.
Right.
Well, see, the thing is, so for example, I mean, this is different, but because basketball, I grew up playing basketball. Now in the NBA, there's been a lot of Achilles injuries in the last couple of years into major names. Like for example, in the NBA Finals, it was Game 7. Tyrese Halliburton came out on fire, hit 3 threes, then tore his Achilles, right?
Yeah.
And the question going around the NBA is, why are we seeing so many lower leg injuries? And the theory is that when we were younger, we grew up playing all different types of sports, right? So we moved all of our muscles, right? So we'll play maybe cricket, play a bit of tennis, even if it wasn't serious. But now people are like they're getting their kids, okay, you like basketball, play basketball only. So even though they're like athletes on top of the range, they're not working those, because the human body has thousands of muscles and tendons and things like that. So because they're not using, the over repetition is leading to all these injuries. I mean, that's the theory. I don't know if that's something that you concur with?
Could be, but I think now that the schedule of all the professional players is so big,
Super intense.
that even for football players, that's why we keep seeing the injury rate increasing.
Yeah.
It's crazy, the calendar for all those athletes.
They have a lot of hamstring injuries in football now.
Oh,
It's
yeah.
interesting. If basketball's Achilles,
Yeah, it's
football
Achilles.
is
But for
hamstrings.
basketball, Achilles, because you see, it's more about a vertical jump and landing,
Yes.
and usually on one leg, so that's the kind of load that is the most powerful tensile load on the Achilles. So that's why in the NBA you have more maybe Achilles rupture.
Yeah, ruptures.
When
yeah,
we
exactly.
just have Achilles tendinopathy. But the number one player in France, 3 to 6 months ago, he had an Achilles rupture also.
And that's
Paddle player or basketball
Because
player?
again, the more advanced the level, the more jumps, the
football
more.
player or basketball?
No, paddle. Sorry,
paddle,
paddle.
yeah,
Number
yeah.
one paddle
Yeah.
player in France had an
Right.
Achilles rupture 6 months ago. So this can happen in paddle also.
Wow. Yeah, no, it's crazy. So, I mean, if we were to summarize some of the points, so obviously warm up, super important. Give
Yeah.
yourself 10 minutes time. In terms of recovery, it's do a warm down as well on a cycle or something like
Yes, if you don't have access to the cold plunge, or if you want
Right.
to save money on it.
that. And even cold plunges and stuff, it's not every day or not after a thing.
Yeah,
Like after a
either
session
after
straight
big
away.
tournaments.
Or, yeah, after a big tournament, or how about like next day, for example? Is that
Yes,
if you're not
don't
playing?
do it right after your game, because we saw
Right.
that it might impact some muscle adaptation, muscle, hypertrophy.
Yeah.
And usually you choose, the time is depending on the degrees. So if it's like 10 minutes, 10 degrees, 5 degrees, 5 minutes. So you adapt like this.
Yeah.
So you don't spend 20 minutes in a 1 degree water.
Yeah.
Alright,
And you
yes.
go into
Yes,
hypothermia.
And then anything else you'd recommend, doctor, in terms, again, from preventative or...
A very good supplement that most of the...
right, you mentioned sleeping and eating as well, yes?
Yeah, that's
Is
the
there
basic
anything
pillar.
else?
But creatine is usually a very good thing
Right.
to be able to perform also the same on the next day. So it's one of the most studied supplement that is very safe. So just 5
huge
grams
right
of...
now.
Yeah.
Everyone's really talking about it.
What about collagen? Because I've been hearing a lot of people taking collagen tablets
Yeah.
for the muscles and tendons. Do you feel like...
There's pros and cons. I haven't studied the full literature for collagen. Maybe it's overrated, but I can't give you a specific answer right now because I haven't checked the literature regarding collagen.
So creatine, sorry, you're mentioning 5 grams?
Yeah,
A
it's
day?
usually what they give you
The
for the
scoop.
dose. The scoop, yeah.
Or so you just put it in your water
Yeah.
or in your...
Or if
Yeah.
you want to have more protein intake, you can add it with the whey, for example, if you want to make sure that you meet your protein
It's like
intake.
take it like an hour before you play or after you play?
I would say after, but there's no rush. Before we used to say we need to take that shake like in the hour following the training.
Yeah, that was
we
a
know
big
that
thing.
we have the insulin sensitivity for the next 6 to 8 hours, so there's no rush.
Okay, nice.
What do you think of working out at the gym in relation to paddle? Helpful, not
Yeah.
helpful?
We talked about the plyometrics with
Yeah.
the legs, so leg power with like box jumps or skipping rope, this kind of stuff. Yeah, it's
Well,
very
I've been
interesting.
seeing the professional players because now they're giving us more insight.
Yeah.
They're doing the one where they get like the medicine ball and they're just like jacking it up
Yeah.
and then dropping it and then sort of repeating to work the upper body. I'm guessing that's mainly for the smash.
Yeah,
You know?
because paddle is a intermittent sports. We usually play 35% of the time on a 90 minutes game. There's only 30 to 35% where we're actually moving and playing. So it's more about
Yeah.
explosive efforts.
Yes.
So that's why we need to work on that plyometric and be able to generate force in a very short amount of time.
Do you recommend weights, like even lifting weights?
Yeah.
Not just,
Yeah.
Okay,
Of course.
muscle building and stuff helps.
Yeah,
Like I
of
said, legs.
course. When you're a paddle
Yeah.
player, your goal is not to go for hypertrophy. So
Not being a bodybuilder, but
Yeah. But yeah, lifting weight is
Yeah,
very
helps,
good
yeah.
for paddle, yeah.
Right.
And all the professional players, like you said, you can see on YouTube, they
Yeah.
all go to the gym. Most of them, they have like a
But they're
PT.
not jacked, but they're like...
they have lean muscle. A lot
Yeah.
of them have
Yeah.
very
Yeah,
lean
yeah.
muscle.
But I've seen a few videos where Augsburger, Dineno, and other Spanish players, they did their grip strengths on live, and you could see the numbers when they did
Oh,
the
wow.
pain-free grip strengths. Yeah,
So they'd be really good at arm wrestling, right?
Yeah,
I'm
because
guessing?
again, when you smash, you tend to squeeze the racket very fast, and you could see that Augsburger was about 70 kg of grip, or even more than that, where all the others are like 60 at the top. So that would explain maybe why his smash is so good.
Even Coelho's Bajada in one of the games was like 200 kilometers.
Yeah, it's impressive.
If I'm not over
like
stating.
Chingo is the only one that I've seen
Yeah.
that can like consistently return it. But if he gets it right, it's crazy. It's like a missile. Like even on the you know how everything's slower on TV. Even on TV, you're like, where did the ball go?
But the funny thing is that he managed to place it just next to the player, where we would aim at the player.
It's like when I'm playing paddle, I'm like, I want to take his head
Because imagine Shingoto getting that 200.
Yeah, if he gets hit with that,
there was that point
hurt.
recently where he hit like 3 of them at him, and he's just like defending himself with the racket, and then they end up winning the point. That's when they beat him recently. It was
That's
very,
part of the
very impressive.
game, though. So, Doctor, maybe we'll wrap up. Maybe just
Just before we wrap up,
go ahead.
if anyone wants to find you, so I think you mentioned that you'll be moving or you're working out of Jumeirah 1.
Yeah, Jumeirah 1. So the clinic is called DPFM. It's next to Jumeirah 1 Town Center Mall. So it's within a mall, so it's free to park.
Nice.
We have a very good team. We have 4 physicians, internal medicine and family medicine, 6 physio, 1 osteopath, and
Coming to you, don't worry.
and a sports massage therapist for recovery. Also,
Oh,
that
amazing.
might be very
Nice.
interesting.
Yes.
The sports massage, of course. Yeah.
Great. And how can we find you in particular, your socials?
Yeah, so social media, you mentioned the Padel Osteo, but the name is at Dr. Dr. Bideau. It's my family name.
Nice.
And if you want to watch more of my paddle highlight, because I have a second account where I sometimes do reels or I share the
great.
stories of my smash, because my name is Dr. Smash
Play against
DXB.
him, man. It sounds like he's better than us.
Doctor Smash.
Dr.
So
dot
DR?
Smash DXB.
Dr.Smash?
Yeah,
DXB.
Dr. dot Smash DXB.
Oh, great.
Okay, nice. That's it. I'm
We'll-
following you. We're definitely going to follow that tonight.
follow
Look.
you. And
Yeah,
great.
but then we can't play against him. If he looks too good, I'm going to be intimidated, man.
No, we have to analyze. We have to have a game, Doc. No, thank you so much. I know we've been trying to have this meeting for a while, and then it was summer and traveled and we came back, but we really appreciate having you. Hopefully, maybe we can have you again sometime and
I had a very good
talk
fun.
more about paddle, because I think paddle players, we just love talking about paddle, everything about paddle. So
Oh, this could last for 2 more hours.
yeah, exactly.
Yeah, 100%. Hopefully, if it grows and stuff, we get a bit more high-profile people, and we get a bit of a following. We'll definitely have you on again, and discuss more things.
Definitely.
Pleasure.
Thanks so much. Don't forget to follow us on all our channels as well, GameSetPadel, and we'll see you next time.